By moving to Skyward, we've been able to increase the number of beds that we have to look after children with heart problems. This has meant that we've been able to undertake more cardiac surgery and treat more children with heart disease than we have been able to before. One of the major benefits of being on the 6th floor on Skyward is that we're able to look after children across a range of dependencies. So we have pediatric intensive care at one end, we have a high dependency unit in the ward, and then we have our standard ward care. And that means that we're able to look after children in the correct environment, and it also means that if there's any change in their clinical condition, then we're able to move them very swiftly and promptly into an appropriate area so that they get the best treatment at the earliest opportunity. One of the great innovations on the ward is that in the cubicles there is a glass door separating them, and this glass door can be made either clear or it can be opaque. This gives us the ability for a nurse to look after two children in cubicles at the same time by being able to go between them. And it also provides us with an ability to be able to isolate children, but also make sure that they're not disconnected from the rest of the ward. So this innovation with cubicle design and the flexibility affords us is something that we've never ever had before. And it's a really exciting way for us to be able to look after the patients. It's a huge benefit to the nurses, and we also hope that will provide great benefit to the patients when they're being nursed in those cubicles. Every bed space has high quality monitoring, whether that be in the bays or in the cubicles, and that monitoring is able to be viewed remotely in the doctor's office and at the nursing station. So that means that even if the nurses or the doctors aren't at the bedside, we're able to keep a really close eye on the clinical condition of the children.